Most people think farsightedness means seeing well at a distance and poorly up close. The logic is straightforward. If nearsightedness means poor distance vision, then farsightedness must be the opposite. But it doesn't quite work that way, and this exact misconception leads many people to avoid seeing a doctor for years, because they think that if they see well at a distance, everything must be fine. In reality, farsightedness is a condition in which the eye works under constant strain. In young people, this strain is compensated so effectively that they notice nothing at all. In middle age, problems with reading emerge. In older adults, difficulties arise both near and far. And between these stages, years of eye fatigue, headaches, and no understanding of where they're coming from. Today we'll look at what farsightedness actually is, how it presents at different ages, and what can be done about it. To understand farsightedness, it helps to recall how the eye works. When you look at an object, light rays pass through the cornea and lens, are refracted and should focus precisely on the retina. With normal vision, that's exactly what happens. In farsightedness, the eye is either too short or the cornea isn't curved enough, so the focal point ends up not on the retina but behind it. The image arrives at the retina before it has fully converged, but the eye has a compensation mechanism, accommodation. The lens can change its curvature, contract, become more convex, and thereby increase refraction, pulling the focal point forward toward the retina. This mechanism is what allows young people with farsightedness to see normally, at the cost of constant muscular effort. The eye is working even when you're simply looking straight ahead, and that's the core of it. While a nearsighted eye rests in its relaxed state, a farsighted eye never fully rests. It's always slightly tensed. And the higher the degree of farsightedness, the greater that tension. Farsightedness isn't a static condition. How it manifests changes with age, and this matters. In children and young adults, farsightedness can be completely hidden. Accommodation in young people is powerful. The lens is flexible and responsive, easily compensating for the lack of refraction. A person sees normally, sometimes even better than expected. But the eyes are working under constant strain. The first signs aren't declining vision, they're symptoms of overload. Headaches, particularly in the forehead and behind the eyes. Eye fatigue after reading or screen work. A feeling of heaviness in the eyes toward evening. Sometimes mild doubling or blurriness after prolonged visual effort. After the age of 30 to 35, accommodation begins to weaken. The lens gradually loses elasticity. The effort that used to come easily no longer fully compensates. Reading difficulties begin. Small text becomes harder to make out. The book or phone needs to be held farther away. This is the classic picture. After 40 to 50, accommodation declines further. Now the eye struggles, not only up close, but begins to see poorly in the distance too. A person finds themselves in a situation where vision is poor at all distances simultaneously. This is called manifest farsightedness, no longer compensated by the eye's own resources. Almost all newborns are farsighted. This is normal. The eye hasn't yet grown to its final size. As the child develops, the eye lengthens, farsightedness decreases, and it usually resolves by school age on its own. But this doesn't always happen. If the farsightedness is significant, the eye can't compensate on its own, serious consequences can follow. The first is strabismus. When a child with high farsightedness tries to focus on a nearby object, they strain accommodation so intensely that it triggers excessive convergence of the eyes inward. This is how accommodative convergent strabismus develops. In these cases, simply prescribing glasses often completely resolves the problem. The second is amblyopia. If farsightedness exists in only one eye, or is more pronounced in one, that eye works significantly harder than the other. The brain begins to suppress it, preferring the one that functions with less effort. Amblyopia develops, reduced vision without organic cause. This is why ophthalmologists insist on routine examinations for children at age 3. Farsightedness in a child isn't obvious. They don't complain about poor vision, they simply adapt. but the consequences can be serious and, if caught late, irreversible. Farsightedness is measured in diopters with a plus sign, unlike nearsightedness, which is marked with a minus. Mild, up to 3 diopters. Young people most often compensate fully without glasses. Main manifestations are fatigue and headaches. Moderate, 3 to 6 diopters. Compensation is harder. Difficulties emerge during close visual work. High, above 6 diopters. Compensation is impossible even in the young. The person sees poorly both near and far from the outset. If I see well at a distance, I don't have farsightedness. This is incorrect. Young people with farsightedness see at a distance thanks to constant accommodative effort. Vision is normal, but the eyes are overloaded. This can only be detected with a dilated pupil examination, which disables accommodation and reveals true refraction. Farsightedness is an older person's problem. Farsightedness can be present from birth. It's simply more often hidden in the young and manifests later. If I wear glasses, my vision will get worse. Glasses don't worsen vision. They allow the eyes to function without constant strain. Headaches and fatigue result from this. My eyes are just tired from screens. It's not farsightedness. Screen fatigue can be a symptom of hidden farsightedness that hasn't yet manifested as reduced visual acuity. Worth checking. Glasses and contact lenses are the standard approach. For farsightedness, plus lenses are used. They enhance refraction and allow the eye to function without strain. Properly prescribed glasses eliminate fatigue and headaches in most patients within the first weeks of wearing. Laser correction is also applied for farsightedness. The laser reshapes the cornea to increase its refractive power. Indications and contraindications are the same as for nearsightedness: age, refractive stability, corneal thickness. Results at moderate degrees are good. High degrees are assessed individually. ICL lenses for high degrees of farsightedness, where laser correction isn't possible or suitable, phakic lens implantation is used. A lens is placed inside the eye to compensate for refraction. If you regularly have headaches in the forehead or behind the eyes without obvious cause, that's a reason to have your vision checked. Not to start with an MRI or neurologist, but to begin with an ophthalmologist. If your eyes tire more than before after prolonged computer work or reading, also worth coming in. If a child squints, reads poorly, or complains of eye fatigue during lessons, don't wait. Routine examination with farsightedness is just as important as with any other refractive issue. Especially if glasses are already prescribed, their parameters need regular review. Farsightedness is a condition that's easy to underestimate, because for a long time it doesn't interfere with seeing. But the quiet overload that accumulates for years in the form of headaches, fatigue, and tension is also a cost. And in children, the consequences can be more serious than they appear. The good news? Farsightedness responds well to correction. Properly prescribed glasses or lenses change quality of life quickly and noticeably. And for those who want it and have the right indications, it can be addressed with laser or other methods. If you haven't had your vision checked in a while, or headaches keep appearing for no clear reason, come in for an examination at Ko'z Nuri Clinic. We conduct full refraction diagnostics, including dilated pupil examination, which reveals hidden farsightedness. After the exam, you'll have a precise picture of your vision and specific recommendations. Contact details and booking are in the description below.